It's time for Mental Health Monday. I had a friend that suggested I remind people why I can talk about mental health, and it's because I've been a therapist since 1991. I've not always worked as a therapist. Sometimes I was doing pastoral care, sometimes I was a school counselor, sometimes private practice, sometimes hospice care. So I've had a lot of experiences in mental health with people. So, today I wanted to talk a little bit about hospice. I loved working for hospice, but I feel like people don't know that they should talk to hospice earlier than they do. And I know it's the fear that if I call hospice, it means my loved one is dying. But hospice can bring in so much help, organize a person's meds and lift some of the burden of the caregivers. I've seen people actually graduate from hospice. And of course, they can be there to help a person have a good death without pain and without all the trauma that can surround someone who doesn't have that kind of support. So hospice, call them sooner than later. They have a lot of wonderful things they can bring into a life. When I worked for hospice, we had a great team, and we would find ways to celebrate people that were living, not dying. We had a couple that had never had enough money to celebrate an anniversary, so we threw a party for them. We had a man who had been estranged from his 5 kids forever. He never even met the 2 youngest twins. We were able to find them, and he had a reunion with them on our little iPad, and they all just cried, and it was beautiful. So hospice can offer spiritual care, social work, CNAs to help bathe, doctors and nurses that will help organize and take care of the medicines that are needed. And it can be a beautiful thing because all of us prefer, I'm sure, a good death.